Immunization is essential to protect your child from infectious diseases. Therefore, it is important for children to be vaccinated at the right time. Vaccines are safe for children, but sometimes adverse events or AEFI following immunization may occur. Some of the common AEFIs are pain, swelling and redness at the site of injection, low-grade fever, irritation and malaise. There are a few serious and rare AEFIs requiring immediate medical attention. Anaphylaxis is one such serious condition. This story is about such an incident in which a medical officer is conducting a monthly review meeting with the lady health visitor and ANMs at the primary health center, and they are discussing about anaphylaxis. Let us see what is happening during the meeting.
I would like to start the meeting by congratulating ANM Rashmi for saving the life of a child who had anaphylaxis by immediately administering an injection, adrenaline, which improved his health condition. Well done, Rashmi.
Rashmi, can you share your experience with us?
Why not, Sunita Didi? Definitely I will.
So tell us, Rashmi, what happened that day?
As always, that day too, I asked the mother and child to wait at the session site for 30 minutes after vaccination.
Please see, what is happening to my Suraj?
Oh, his face is swollen and it looks like he has difficulty in breathing.
Oh God, what is happening to my child?
Don't worry, it seems that he's having an allergic reaction. First, I will give him an injection, which will make him feel better. And then we will consult a doctor. I suspected it as symptoms of anaphylaxis. I immediately started preparations to give him a dose of adrenaline. First, I referred to the dose chart in the anaphylaxis kit and loaded a syringe with the age-appropriate dose of adrenaline. Then, I cleaned the middle one-third of anterolateral aspect of the thigh and at 90-degree angle administered the adrenaline injection intramuscularly. Afterward, I informed the medical officer of the nearest primary health center and also called an ambulance. The ambulance has arrived. Listen, take the child to the doctor. I have already informed the doctor of primary health center. And look, he seems to be better now.
Yes, thank you so much. I was so worried.
It is natural for a mother to be anxious about her child. The child reached the health center. And after treatment, he recovered completely within a few hours.
Well done, Rashmi. You handled the whole situation intelligently. Well done.
Thank you, madam.
Madam, what is anaphylaxis?
Anaphylaxis is a serious allergic reaction which usually affects the respiratory, cardiovascular, and dermatological systems. It is important for all of us to understand anaphylaxis.
Madam, how can we recognize anaphylaxis?
Renu, the symptoms of anaphylaxis usually appear in a few minutes or within 1 to 2 hours of vaccination, and it progresses rapidly. Symptoms of anaphylaxis can be seen in 3 systems of the human body. The respiratory system, in which there is difficulty in breathing, swelling of the tongue, lips and throat, stridor, harsh vibrating sounds during breathing, wheezing, breathing with whistling or rattling sound in the chest, cyanosis, bluish discoloration of the tongue, ears and lips. The cardiovascular system, in which symptoms are increased heart rate, low blood pressure, loss of consciousness, fainting and dizziness. The dermatological system, in which symptoms are itching, redness of the skin, raised red skin lesion, swelling of subcutaneous tissues of the upper eyelids, lips, tongue and face. Anaphylaxis progresses very quickly, so it's very important to keep children under observation after vaccination and provide immediate medical treatment when needed.
That's why beneficiaries are asked to wait for 30 minutes after vaccination. so that in case of any symptoms, quick measures can be taken.
That's right, Sunita. If one sign or symptom related to any two of the three systems is seen, then anaphylaxis should be suspected in such a child, and immediately one dose of adrenaline as per his/her age should be administered to the child.
Madam, in case of anaphylaxis, what is the role of the ANM?
If treatment is not started on time, anaphylaxis can be life-threatening. Now, ANMs are allowed to administer a single dose of adrenaline to a suspected anaphylaxis case. So always make sure that you have an anaphylaxis kit with you during an immunization session.
Make sure that anaphylaxis kit is always ready to use. ANMs should ensure that every 3 months the anaphylaxis kits are certified by the medical officer for expiry date.
Absolutely right.
Madam, what are the contents of anaphylaxis kit?
Good question, Pooja. An anaphylaxis kit consists of 3 1 ml ampules of adrenaline, 1:1000, 3 1 ml tuberculin syringes, or 40 unit insulin syringes without fixed needles, 3 1-inch long 24 gauge or 25 gauge needles, and swabs to clean the skin. Ensure that adrenaline is within expiry date for the next 3 months. Remember that adrenaline is also called epinephrine. In addition to these, an anaphylaxis kit has an age-wise dose chart for adrenaline, updated contact information of the medical officer of PHC or CHC and local ambulance services, and a format for quarterly certification of anaphylaxis kit by the medical officer.
Madam, once we are sure that the child has anaphylaxis, what should we do?
Don't wait for confirmation of anaphylaxis. As soon as you observe the symptoms and suspect anaphylaxis, administer 1 dose of adrenaline immediately without hesitation. Later, if it turns out that this is not a confirmed case of anaphylaxis, 1 dose of adrenaline will not harm the child. In case it is anaphylaxis, this 1 dose can save a life. Always inform the medical officer of the nearest health facility and immediately arrange for an ambulance to transfer the child to the health facility. If an ambulance is not available or there is a delay in its arrival, arrange another vehicle to transport the patient to the nearest health facility. It is important to always keep updated contact numbers of the nearby hospitals at the primary health center.
Madam, what is the correct technique to administer adrenaline injection? Tell us.
Alright. First, refer to the appropriate dose chart and find out the age dose of adrenaline required for injection. Attach a 24 gauge or 25 gauge 1-inch long needle to a 1 ml tuberculin or 40 unit insulin syringe and load the age appropriate dose of adrenaline. Clean the middle 1/3 of anterolateral aspect of the thigh with a swab and give deep intramuscular injection at 90-degree angle, just as you administer pentavalent or DPT vaccine. Note that if the child is conscious, keep him or her in the supine position with lower limbs raised higher than the head level so that flow of blood is towards the heart. If the child is unconscious, keep him or her in the left lateral position so that he or she does not choke on his/her vomit. Also keep the following in mind. Note the time of administration of injection adrenaline. Inform the medical officer about the condition of the patient. After administering adrenaline, document the fact on the immunization card.
It is very important to understand all of this. Since parents and guardians trust us, it is our responsibility to ensure that no lives are lost due to anaphylaxis. So, will you remember everything that we discussed about anaphylaxis?
Yes, Didi, very well.
They will remember all of this about anaphylaxis. What about you? Let us repeat some important points. Ask all beneficiaries to wait for 30 minutes after vaccination at the session site. Always keep an anaphylaxis kit ready at every immunization session. Ensure that the medical officer certifies expiry dates of adrenaline and other contents of the anaphylaxis kit every 3 months. Check the label of the adrenaline ampule for expiry date before administration. Immediately administer a single dose of injection adrenaline to a child suspected of having anaphylaxis. Use the dose chart to find the age-appropriate dose of adrenaline. Always administer a dose of injection adrenaline by deep intramuscular route on the anterolateral aspect of the mid-thigh. After administering adrenaline, inform the medical officer of nearest health facility about the case for timely management. Adrenaline injection given should be mentioned on the immunization card in block letters. Arrange for an ambulance to transport the child to the health facility. Always remember, if you suspect anaphylaxis, immediate administration of 1 dose of adrenaline intramuscularly will be life-saving intervention.